Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 5 of our course in the Principles of Healthcare Research. And once again, a very nice week of discussion. We are right now at the halfway point of the class, so congratulations on having it made to this halfway point. And we covered a lot of territory. This week, the primary uh, thing that we did was we reviewed this rather large study that was conducted in 2002, the Aiken study on hospital nurse staffing and patient mortality, nurse burnout, and job satisfaction. Um, and we discussed the type of research that was designed and a little discussion about how a more rigorous design might have been used, or would a more rigorous design be appropriate. And I also talked about, variables and what kind of variables need to be controlled for in a study. Just as a general rule, no, of course, there was also quite a bit of discussion about just the concept of nurse ratios, and burnout is something that I think that most of us can relate to, especially any of us that have worked any length of time in bedside nursing. Some things about this journal article in particular. This is a very large study. This is larger than most studies of this nature, and it was done in 2002 primarily in response because this is the time shortly after California had moved to make mandatory nurse to patient ratios and actually codified into law. In California, there's certain laws that must be followed as far as the number of nurses that can be assigned on a unit based on the number of patients. And so this was a study that was done in response to that. And so it was basically, they got half the nurses in the state of Pennsylvania. They sent out a questionnaire, or sent out a request to participate in the study to about half the nurses in the state, and to which about a quarter of those, or about half of those nurses, or roughly about 25% of the nurses in the state of Pennsylvania, responded and participated in that study. And that's actually quite a large study. That's actually, having 1 in 4 of a specific uh, target population participate in a study like this actually lends a lot of credibility to results. Also, there was many steps that were taken to exclude nurses that worked possibly in areas that might skew the results. So nurses that worked in non-acute areas or in certain types of hospitals were excluded, and also non-federal hospitals were not included. They tried to make this as controlled a study as they could, which was difficult given the number of patient records that they reviewed. It's also what's known as a cross-sectional study. Cross-sectional essentially means that it was the data was collected in a given specific period of time, and so the data that they collected from medical records was collected at the same time as data that they were getting from nurses. And so they came up with this rather large, in some ways a somewhat cumbersome study. Doesn't mean it's a bad study. I don't mean to make it sound like this is a poorly done study. It's just that it's rather large, and so it was meant to take in a wide amount of information from a lot of different sources. And so that is both a strength and a weakness in the study at the same time. It's strong because it does include a lot of information, but one of the weaknesses in the study is that because it is so large, it is hard to really identify or kind of sort of get into the weeds about, like cause and effect. You really can't use the study to determine cause and effect. Does nurse burnout cause increased patient mortality, or really, can you really even draw up a cause and effect relationship between nurse staffing and mortality? It's difficult to do from this particular study. Again, it doesn't mean it's a bad study. It just means that this is a study that is kind of a jumping point off into other studies that might want to be conducted on the same topic. And so very good discussion this week on this particular study. We'll be referring to it again. We'll be reviewing it in future weeks. Also, just a reminder, if you haven't done so already, the midterm exam is due this evening. You need to get that started before about 11 o'clock Eastern time tonight. I'm recording this on Sunday of week 4, so you want to make sure that you get in and that you complete the midterm exam if you haven't already. And as you have any questions about that, please let me know. In week number 5, you have 2 things that we're going to be doing. The first is our discussion question, and again, we're going to be looking at the same hospital nurse staffing study, the Aiken et al. Study, and we're going to talk about target populations and say, look at the target population and identify the target population and the study sample, and talk about the sampling plan, and sort of have a general talk about how samples are compiled, how samples are determined in a study, and then how they are the results from those studies, how they are then generalizable to a larger population, or to what population do they apply. And that will be the primary focus of the discussion this week. Also, you have your first research study critique due. This is going to be a quantitative study critique. I've posted some information on this, so please make sure that you get started on these early. It looks like it's a simpler assignment than it is really. It actually takes quite a bit of time to go through and do a thorough job in the critique. So, and remember that the critiques are a total of 25% of your grade for each one of those critiques. So, it does have a large impact on your grade. The largest impact on your grade, as a matter of fact, is your work on these critiques, which is why I've given you that guidance on how to approach the individual questions and how to approach the individual criterion that you're going to be assessing in those research critiques. So if you have any questions, as always, please feel free to let me know. Enjoy the rest of your Memorial Day weekend. For those of you that are veterans or have family members who are veterans, I hope that you spend some time with them and just lend support as you can. And I look forward to seeing everybody in the discussion questions. As you have any questions, let me know. We'll see you in class.